I'm Dr. Ping Yu, a senior lecturer in School of Information Systems and Technology, coordinator of Health Informatics Research Lab in School of Information Systems and Technology. My major research field is health informatics, and particularly the application of technology in aged care. Currently, I lead a team of 6 PhD students. We investigate how to get technology work well in aged care sector, particularly electronic health record system. So because particularly in the healthcare, healthcare workers are all have lots of documents they have to use because they rely on information for healthcare services they provide to patients in hospital, to residents in nursing homes. And the nursing homes are getting funded by accreditation. They have to pass standards of care before they get government funding. So the record system is so important. But care staff spend too much time on documenting instead of provide direct care to patients. That's a drive for the move to electronic health record system.
What do you think about electronic healthcare?
Electronic healthcare is not accurate term.
Or electronic health records.
Electronic health record in the long run is beneficial in general if it's used meaningfully.
Yeah.
So, for example, in nursing homes, we have evaluated the usage of electronic nursing documentation system in 3 management groups. So in around 12 residential aged care facilities. The care staff members, I interviewed lots of people. We have conducted a survey which have 350 participants, and the overall feedback is overwhelmingly positive. The benefits received so far is improved information quality, particularly legibility of records, because the handwritten records most of the time is very difficult to identify. So records is legible, it's accessible. Because if it's in paper, you have to go there to physically scratch the paper, and now they can access anywhere.
Do you have any concerns about potential data creep or that?
Yes, that's the possible risks for it. It is a risk for electronic health records, but you're looking at the general benefits is accessibility to records and the more holistic view of a resident, which is the prerequisite to the good provision of care. So it significantly improves the quality of, the record management system, and which in the end is about how the care staff understand about the patient and provide the relevant care. But if the system breaks down, or the records is hacked by malicious people, then that can be a risk. So that means the technology developers, when they develop the technology, they have to put all this risk management strategy in place. So risk management, 2 sides, is one your systems risk management, another your practice. So they do have lots of challenges in educating the care staff members and also technology developers and information managers to looking at the records safety and privacy and consent of records. Because this consent issue and the records assessment or management is not just for electronic format, it's also paper format. So, and in healthcare, there are several legislations in Australia about how to manage records. To my knowledge, most of care staff have a very clear understanding of what the legal requirements are, and normally very good staff members abide by the law. But they do, possibly most care workers realize the benefits of health records, but still lack of understanding of the potential risks and privacy breach. And that really put back to the responsibility to the developers. So the system developers should develop enough secure protection mechanism into the system. And I think the technology is there. But just the developers need to integrate the technology into the solution. which I think is still need to be improved and always need to be improved.
Yeah.
Because every system has a risk. So electronic system is the same, because particularly with this record system, sometimes electricity went down, sometimes the network went down. All those are the risks.
Yeah.
Everyone realized that, they used that, but key staff in the end, they still accept it because compared with old practice, they think the benefits is a lot better than the risks. And of course there is risk, but the risk can be managed.